Clinical Psychology by Ellie Cordova. Now, what is clinical psychology? Clinical psychology is a career focused on improving the well-being of others. This is done by incorporating science theory and clinical knowledge to understand, prevent, and relieve psychological-based distress, such as anxiety, depression, and stress. Inside of this career is a lot of variety. As a clinical psychologist, you can practice psychotherapy, which is where you talk with patients about their problems, research, where you research psychology and try to advance the field, teaching, where you teach others how to be psychologists, and many more areas. When working in this career, you can choose one or multiple of these areas to work in. Both of these points are reasons why I'm interested in this career. I am very passionate about having a job that helps other people. I also like the idea of having many different options once I become a clinical psychologist. I personally would want to work in psychotherapy, so I will be mostly focusing on that for my presentation. I am confident I will be a good fit for this job as well. I can be a curious, empathetic, patient, and communicative person, which are all personality traits that work great in this career. My goal in this field is to learn all I can about the interesting subject of psychology and use that knowledge to help countless others feel better. Before learning more about clinical psychology, let's explore how this career came to be. The start of the practice that clinical psychologists use today really didn't begin until 1886, when Sigmund Freud invented psychoanalysis. This was when professionals would encourage their patients to talk freely about their problems to come to a solution while laying down on a couch, much like you see in the movies. Today, psychotherapy is not very much like this. In 1896, the first psychological clinic where clinical psychologists worked was developed at the University of Pennsylvania by Lightner Whitmer. The official beginning of today's clinical psychology was in 1945. Before the end of World War II, many psychologists were only testers of the IQ, personality, and mind. Then, when all of the traumatized veterans came back from war, therapists could not perform therapy for everyone, so clinical psychologists started in the business of solving mental problems, not just diagnosing them. Today, clinical psychology has advanced a lot. Psychologists can practice certain new methods in therapy that use different techniques to meet the job's goal. One of the most popular methods used, and the one I am most interested in exploring in my future, is cognitive behavioral therapy. This method involves identifying and then changing the patterns of behavior and thoughts that are contributing to problems. There is also client-centered therapy, systematic therapy, and many more. Within these methods practiced are techniques used to overcome the problems. There is relaxation and imagery that helps someone with stress and psychological exposure that can help someone feel more comfortable in certain places or with certain subjects. One tool that is commonly used in treatment is biofeedback equipment. This measures your involuntary responses such as heart rate and brainwaves to see how you react to certain things. This can help psychologists know how to help you and track your progress. For example, the one shown right here is a small device that measures your hand temperature to track your stress. Patient's information usually resides in electronic medical records for tracking. These files, along with biofeedback reports, confidentiality contracts, and prescriptions for medication, are all forms used in this career. To be able to use all these tools and methods and to be a good psychologist, you need to have certain skills. Some that are important are interpersonal skills to interact with clients, communication skills to talk with clients, and also observational skills, analytic skills, and numeracy skills to process data. To be a clinical psychologist, you also need a certain education. First, you need to get a bachelor's degree in psychology at a 4-year college. Then you would go to graduate school to get your master's degree in clinical psychology for 2 years. Next, you would continue at graduate school and get a PhD in clinical psychology or a PsyD after 4 years. While working for your degree, most states require you to complete a 1-year pre-doctoral internship with a psychologist. Finally, you would get a psychology license from the State Board of Psychology. After all that hard work, you will definitely be rewarded with this job's salary. For your internship in school, you would get paid $20,000 to $25,000. Then when you begin your career, your median annual salary is $70,000. After 10 years, your salary is approximately $80,000. After 20 years, your median jumps to $90,000. And finally, in your late career, the average range is $60,000 to $140,000 each year. You can even be paid higher or lower depending on your work. Your bonus also increases the longer you work. Luckily, California is one of the states that clinical psychologists get paid the highest. Speaking of clinical psychology in California, I visited 2 places that employ clinical psychologists in our area. One is the Martinez Veterans Hospital, and these are the therapy rooms and offices there. I also visited Palo Alto University, which is a graduate school for psychology. The students there go to the school's clinic and practice psychotherapy with clients for a discount. These are their therapy rooms. The rooms are made to feel peaceful, quiet, and cozy so patients can feel comfortable. The clinics themselves are set up to feel private, safe, and professional. This is one of the rooms for meetings and research. Clinical psychologists who work in psychotherapy don't just have to work in treatment centers. They're able to work in private practice, mental health hospitals, prisons, military bases, and higher education organizations to help people in these settings. I interviewed Dr. Matthew Cordova, who is a clinical psychologist who works in psychotherapy at the Martinez VA and teaches at Palo Alto University. These are some of his responses to my questions. Now, can you walk us through your workday?
Sure. Each day I kind of do a mix of things. So some of the time I am doing counseling with patients. So people come to my office and I meet with them to help them either talk about their mood or their emotional struggles, or help them manage their physical problems like chronic pain, or help them lose weight, or different things that they're trying to do to improve their health. I also supervise people who are training to become psychologists, so I meet with them and help them uh, know how to best help their patients. I also teach classes, and I also do research, so I am working to try and understand how people adjust to trauma. So each day I'm kind of doing a mix of all of those things.
What is your favorite part about being a clinical psychologist? And what are some difficulties that come with being a clinical psychologist, specifically for veterans?
My favorite part of being a clinical psychologist is seeing people work hard and improve their lives. Some of the challenges are working with people who are kind of hopeless at times, or who maybe are feeling very angry and misunderstood by other people.
How has clinical psychology changed since you began your career? And what future changes do you think are in store?
It's changed over the past 20 years, which is about how long I've done this, because it's become more science-based. There's more and more pressure to use counseling strategies that have evidence that they're useful and effective. So that's one way it's changed. And the way it's changing is that we're more and more focused on trying to treat the different mechanisms that cause problems.
Not only will the practice of psychology change in the future, but the career as well. According to the U.S. Department of Labor, jobs in the field of psychology will grow about 12% over the next 10 years, resulting in approximately 18,700 new jobs. In the last years, employment opportunities for clinical psychologists have increased much faster than the average of many jobs nationwide. This is thought to occur because of the increase of demand for mental health treatment. Knowing that there will be a place for me in clinical psychology in the future, I know that I am still interested in it. I would be able to make people feel better, have freedom in my career, be creative with solutions, and work in a professional environment. Right after high school, I plan to get my bachelor's degree, master's degree, PhD, and finally my license so I can achieve my goal. I want to be a clinical psychologist.